could go on and on. I know a lot of these leaders, they're friends, and I have a tremendous amount of confidence that they're going to lead on issues of culture and family and marriage and life.
On the issue of life, Harvard Medical School reported that on average about 45,000 people die every year because of lack of health insurance. I know you don't like the health reform bill passed last year. Do you think to protect life, Republicans in Congress have to propose a solution that covers everyone?
Well, that depends on what you mean by covers everyone. I don't favor a federal, national, individual mandate that says that if you don't purchase health...
But maybe another mechanism.
Well, we have actually already been working on other mechanisms for years. I mean, we've been, during the Bush administration, the Republican Congress significantly expanded community-based health clinics where people could get free care.
Right. But there's still 50 million uninsured during the Bush years.
Yeah, but that
really
doesn't mean they're not getting health care. There's a difference between being uninsured and not having health care access. And I think I'm the son of an MD. So I grew up in a small town in North Georgia. Excuse me.
No problem.
And I assure you, there were a lot of people who came to see my father who didn't have health insurance. Certainly didn't have health insurance that covered their eye exam. Mm-hmm. He saw them.
So you think that kind of charity could be the public policy plan? Or
I didn't say that. I said we've been advocating a lot of things. Community-based health clinics, for which there is matching state and federal money, to provide quality health care access for people who don't have health insurance is not a charity-based solution. Secondly, Republicans have worked for decades to expand Medicaid where we are able to provide access to Medicaid for people who are above the poverty line. If Barack Obama had come forward with a plan that would have provided matching federal funds for state efforts to expand Medicaid for people who didn't have health insurance, he would have been able to pass a bill with 250 to 300 votes. Oh, that isn't what he did.
I think Lamar Alexander said that's like expanding single payer if you expand Medicaid.
Well, all I can tell you is that governors with R's after their name who are social and fiscal conservatives across the country have done that.
All right.
So there's lots of ways. And yes, there is a faith-based and private solution as well. I do not support, and our organization does not support, an individual mandate passed at the federal level that would fine or tax any individual that doesn't buy a health insurance plan that has been approved by a bureaucrat in Washington. We don't think that's a solution. We think it will raise prices. We think it punishes the poor. It will cause lots of people to be herded out of private insurance plans and onto government plans who currently like their health insurance. Because small businesses will look at it and say, why am I paying $3,000 or $4,000 per employee per year to insure them when all I got to do is cancel my insurance, dump them onto the government plan, and I only pay a fine of $2,000.
Well, it's a little cognitive dissonance there if you want to expand Medicaid, but then you say it's a terrible idea to put people on a government plan.
I didn't say I wanted to expand Medicaid. What I told you is that if he had gone forward with a plan like that, he would have been able to pass it on a bipartisan basis.
And you would have supported that?
I didn't say that. I said I would have. I can't say what I would have supported when it was never even proposed.
Okay, well,
it would have
you're proposing something right now, though.
I gave you a range of things that Republicans have been doing for decades. That's what I did.
Fair enough.
I would have to see it and look at it and study it before I could say whether I could support it or not. But when you ask, don't Republicans have to propose something instead and not just oppose?
No, my original question was 45,000 people died because of lack of health insurance. That's a pro-life issue to cover people with health insurance. What do you think this new majority should do to cover this crisis? There is a health care crisis.
I gave you a range of answers, okay, of things that could be done.
You said community health clinics.
Things that we have worked on, number one. Number two, I'm not sure that your statistic is accurate.
So how many people do you think die?
I'd have to look at it. I'd have to investigate it, but I don't think your statistic is accurate.
All right. Thanks.